Hello and welcome. I'm Digital Assistant to Marta, and this is the Tackling Poverty and Inequalities podcast. Over the next while, the team and I have decided that we want to do a series of interviews with a number of organisations across the board. Not only that, but the questions won't be coming from us, but they will be coming from our very own lived experience forum members, giving them the chance to have their voices heard firsthand, which is what the forum really is all about. For our first interview today, we have Marta from the Rowett Institute at the University of Aberdeen, and she is here to talk to us about the work she has been doing alongside Professor Alex Johnson, as well as answering our members' questions surrounding food-related issues. Welcome, Marta.
Hello, Tamara.
Hi. I'm aware that you're working alongside Professor Alex Johnson on the FIO project, which, for those who aren't familiar, is a study looking into food insecurity in people living with obesity. Could you tell us a bit about the study and who's involved and what you hope to achieve with the project?
Yes, so thank you for inviting me, first of all, to be part of this initiative. And we do support the Challenge Poverty Week as well on our social media. So the FIO food, yes, you described what the project is about already, but it is a big multi-centered project, and it's funded by something called Transforming UK Food System Strategic Priority Fund. So we are only one of those projects that are focused on transforming the whole food system to make that change. And I've already mentioned it's a multi-centered because we have Professor Alex Johnston from the Rowett Institute, which is University of Aberdeen. She's the lead of the project, but we also have academics from University of Liverpool, Leeds Beckett, University College London, and the local one, the RGU as well, supported by early career researchers such as myself, and also one retail partner to get that insight into the real retail environment and what changes could be made.
Yeah. Okay, that's interesting because we have a few questions about local shops and things as well, so works perfectly for us. And the study does sound really interesting, so I think me and the team would agree that we're looking forward to seeing what comes of the project. So now we'll move on to the public ask questions part of the episode. I'm going to begin by reading a statement regarding a concern that they have, and then there'll be questions following the statement. So, as you're aware, Aberdeenshire is a large rural area, and one of the issues that's been raised by those experts of experience is that the availability of affordable, healthy foods being hard to come by within their local communities. One forum member stated that their local shop is very overpriced and is only really good for a pint of milk. Even if they travel to the next town, the closest shop is a co-op, which is much more higher priced than your average supermarket. They also stated that the range of fresh food within the co-op was reducing and being replaced by expensive ready meals. Off the back of this concern is that even when they can get fresh food, it's priced higher than unhealthy foods. For example, they stated they could purchase 4 cupcakes for £1, but when it came to purchasing a fresh iceberg lettuce, it was £2, which this person, due to being on local income, found very frustrating. It might be important to note also that this particular statement comes from someone who was medically advised to stick to a healthier diet to avoid diabetes. By hearing this statement, we can see people want to make healthy meal choices for themselves and their families, but they just don't seem to have the choice. So my first question would be, how could we support those on low income with limited resources access affordable and healthy food?
So yes, thank you for sharing those very valuable insights. And of course, the answer will not be very easy to that. And as a project, we don't have the answers ourselves yet. And it wouldn't happen overnight. This is, as I said, something that would have to, the whole system would have to change. So it's not, this is something actually really important, which we entering year 2 of our project. So we do start to have some data coming in through, and this is really exciting because what we see is the consumers do not perceive education as something that would help them, that would increase the purchases of healthy products, because we can see now that consumers do have that knowledge. They do know they would need to stay healthy, they need to increase their fruit and vegetable intake, and let's say fish and healthy produce. But this is simply not affordable in a current situation and cost of living crisis. With inflation as well, we can observe that the healthy foods increased by 5%, while the less healthy foods by 2.5%. So very often, and we do have that from our focus groups and interviews, those insights that buying a bag of chips, frozen chips, and a bag of chicken nuggets is much cheaper than buying salad ingredients, for example. And this is across the country in a small shops and in a large supermarkets as well. And this is something also that is very interesting. You mentioned the problem of diabetes, but also problem of obesity. Many, let's say, politicians, for them, it's some sort of a paradox how people who are food insecure can also live with obesity. And this is a very common misconception, and it's something that's actually really happened as well, that the processed food high in fat, sugar, salt are often cheaper than health promoting foods. So this is something that we need to look into along our project and other projects as well. What sort of systematic changes could be made to support these people on lower income, and especially like you said, it's not only the big supermarkets, although this is the focus of our study, but the local shops as well.
I mean, you kind of answered my next question, which was what role you think local shops, including supermarkets, have ensuring the accessibility of the affordability of these healthy foods over unhealthy.
So I could add to that, I suppose, like that the supermarkets are they are of course organizations focused on profit. They are not charity organizations. So they do need to see about their action need to be sort of focused on the profit, but they very often are depicted as those sort of evil organizations that that want to make the society unhealthy. While in fact, working with many retailers, we see that they would also like to make that change for the consumers, but it's often not the most feasible for them. So from the actions that we see the supermarkets are already starting doing is, as you can see, most of the supermarkets now, as you enter the supermarket, you will have fruit and vegetable display at the beginning of the shop, so you would have to go past through it. However, the offers are still limited. As you can see, the offers are usually on less healthy foods rather than buy one broccoli, get one free. That's something you very rarely see. Although supermarkets such as Aldi have this is it Aldi Super 6, I think, initiative that on the day you have 6 different fruit and vegetable with a discounted price. So that also helped to make this diet bit more diverse if you've got the different vegetables each week. So that's the display. They try to guide consumers as well, so providing recipes, but that comes from our data as well, that the recipes and knowledge is not the key driver there. It's unfortunately the price, and that's something that the supermarket itself cannot reduce. This is something that maybe policymakers will have to step in.
Yeah. Okay. Going back to the work you've been doing on the FIO project, I pronounced it wrong the first time, my apologies. Has your research identified any changes by the sector or governments that can support those who want to make healthier choices?
So I think the government is trying to do something to support those healthier choices already, but this have to be this is a very dynamic process. So it's our duty as academics as well to provide those informed, evidence-based sort of policy briefs to help them navigate that space. But one of those interventions, for example, is to introduce those restrictions of food, so-called high fat, sugar, salt, from let's say from the displays or from buy one get one free, and there will be also introduced this restriction in terms of volume of those products as well. So this is one of the things. Also the suggestions for food reformulation for the supermarkets as well. So trying to produce their own brands with less sugar, less fat. But this is something we are still sort of trying. This is this ethos of co-production, which is very important. So to make any change in the system, you need all the stakeholders involved in the system. So that would be retailers, the government, the local governments, academics, and also people most affected, so consumers as well. It has to be a whole process of everybody contributing to it and identifying potential solutions.
Yeah. And our last question is that I'm aware that your study isn't just focused on Aberdeenshire, it's focused, as you said, on all parts of the UK and across Scotland. So is there anything that we could learn from other areas?
Okay, so yes, our project is still in a very early stages. So we start seeing those. It's got 4 different work packages. So one is looking at the lived experience of people through focus groups, through interviews, and gaining those valuable insights. Another work package is focused on analyzing big data, retailers' data, and purchases patterns. While the next work package 3 is looking into potential interventions. So we didn't reach that stage yet. We're still looking into the data, but from now, I think we can even say that there will be no one fit all approach, that this would have to be individually tailored to certain communities. What work in one may not entirely work in the other community. So that's why it's very important, this input of PPI groups, patient and public involvement advocates, to hear their voices, to hear what they think would work in their environment, and work together with the local government, even the NHS, the food and the food retailers, the food producers. So let's say farmers market may work in one community, while it may be hit or miss in the other ones. So this is community-driven initiatives, may be a very valuable thing to look at. And there are some initiatives from, like, top of my head, I'm thinking they're shaping places for healthy lives. This is by Health Foundation. So again, this project sort of incorporates this ethos of co-production and working with all the partners involved, local partners, and looking for this sort of co-benefit as well. How can everybody benefit from a certain setup?
Yeah. Well, I think this has been a great conversation. Again, if anyone would like to learn more, you can check. We'll link it down in the description. You can check out everything they've already put up on there and what's to come. I'm sure that we'll be following along the project for sure. And thank you so much for your time.
No, my pleasure. Thank you very much for inviting me.
You're welcome. And for all the listeners, we hope you enjoyed the first episode in the series of challenging poverty interviews. Make sure that you hit the subscribe button, turn notifications on, and stay tuned for the upcoming episodes in the series. Thank you, and thank you again, Marta.
Thank you.
Bye.
Bye.